You are listening to episode 135 of My to Life Radio. I am Matt Blackburn, and today we're interviewing Dr. Nick Baboulas of Irene Healing Solutions. Nick is based out of Toronto, Canada, and he uses a lot of interesting therapies with his patients after going through a pretty thorough assessment with them. And he uses a lot of the treatments that I use or have used in the past, but some I've never heard of. And the one that we focus on in this interview is called low-dose immunotherapy, abbreviated as LDI. It's actually based on a therapy called LDA, which stands for low-dose allergens or ultra-low-dose enzyme-activated immunotherapy. And that was developed by Dr. Schrader. And there's not many practitioners that are using this type of therapy. I ask Nick how this differs from homeopathy, how it works, how it's administered, how long the treatment is. And it was really fun to talk with him just about the immune system in general and his thoughts on infections and the effectiveness of rife frequencies and rife machines and parasites and low-dose naltrexone and colostrum. Listeners sent in a bunch of questions, and I got to quite a few of them in this interview. So if you've been dealing with a chronic infection or chronic allergies, or you're just interested in learning more about the immune system, I think you'll really enjoy this chat. Here is Nick Baboulas. All right, I'm here with Nick Baboulas. Welcome to the show.
Thanks for having me, Matt.
Yeah, thanks for taking the time to share your wisdom. I was checking out your website and your YouTube, and looks like you've been in this for a while, right?
Oh, well, it's been a couple of years now that I've been kind of like in this area, and it's been like over a decade that I've been in the health kind of area in general. So yeah, I guess I'm starting to age in the area.
What and the low dose immunotherapy thing, that fascinated me when I found your work. How long have you been into that?
So I'd say like at least for the last kind of maybe 5 years, a little bit longer, I've been doing that or focused more on that just because I've seen it be very helpful for patients.
And is it related to like homeopathy? Because it almost seems similar to that.
Yeah, you can definitely say there's overlap there, and like I can definitely get into that a little bit more. But maybe I'll give you a little bit of background, like in terms of where it came from first, just so people can get a better understanding too as well. Does that sound
absolutely.
good?
Let's do it.
Okay, perfect. Yeah, so like just in general, like the original therapy was called LDA, low dose allergy immunotherapy, but then originated in the UK, which was enzyme potentiated desensitization therapy by Dr. McEwen, because his goal was to kind of support allergies or help cure allergies. And then Dr. Butch Schrader from the US, MD, he brought it to the US and he changed the name to low dose allergy immunotherapy. And then since then, there's been three major branches or three major kind of medicines out of that one, which are looking at supporting food sensitivities, general inhalant allergens, and also chemical sensitivities. So that's the focus if we branch out LDA versus LDI, which we'll get into later on, which is the same thing overall, but we just branch it out because there was a starting point where we would get pharmacy-based production of these medicines that we would utilize on patients. And that was specific to Dr. Schrader's formula that he kind of put together based on Dr. McEwen's work. So like we said, the first branch is towards like food. So when people have any sensitivities to foods, this can be very helpful to desensitize them towards that. Same thing with any allergies. So sinusitis, kind of like chronic sinusitis, or kind of like mold sensitivity, or kind of like dust dander, like cat dander or any animal danders, it can be helpful to that. Think anything that you can inhale possibly, it can possibly be helpful for. And the last thing is the chemical part of it, right? So there's a chemical medicine there too that can be very helpful to chemical sensitivities. So that was the starting point of it. And then since then, kind of Dr. Ty Vincent, originally from Alaska, but now he's in Hawaii, he kind of branched it off into like thinking more in terms of utilizing or desensitizing people from microbes. Because he's like, well, if you can desensitize people from like these allergens, because originally too, just so you know, Dr. Schrader had a few specific formulas of microbes that he would use that he just knew that kind of worked for specific conditions. But then Ty branched it out completely into like all the other possibilities that can be from any kind of microbes that you think could affect the immune system. Because the goal of the therapy very simply is if you possibly have an immune-mediated inflammatory reaction in the body caused by something, whatever that blank is, then you can probably create an LDI and desensitize yourself against that blank. So that could be a microbe, that can be kind of like an allergen, that can be even a hormone, that can be like anything you can fathom that you can physically get, you can possibly make an LDI out of in very simple terms. So that's why Dr. Ty branched out to like towards that area where it kind of like, then you got into like different kind of microbes. So like yeast was a major one in terms of that. There's a Lyme mixture, which is another major one. And then there's, of course, different viruses, other different microbes that are out there or that we have in terms of mixtures. And then even hormonal mixtures. So you can make things against, or sometimes people are sensitive to their hormones, especially women, I would say, in terms of specifically during their menses. So they can be sensitive to estrogen or they can be sensitive to progesterone. So the goal there is if you can physically kind of get them to desensitize their physical hormones, then possibly if they're on BRT therapy, maybe they might need a lesser of a dose. Or you can see, and I'll talk about examples in the future, like later on, but where you can kind of get their PMS symptoms to kind of go away if we can find the right dose of that hormone in terms of an LDI dose of it. So that's where it comes down to in terms of the basic starting point for kind of LDI, where it came from.
That's awesome. And how do you create an LDI? Because over the last decade, I've found some pretty cool devices. Like one, I can't remember the name of it, but you would put, there was like two plates, and on one you could put like whatever substance you want, and then it would make like the opposite frequency in the other plate.
Yeah, you can inverse things, like you're using
Right.
inverse frequencies for sure.
Is that kind of the idea, or how, like where, like how would you make an LDI of like estrogen or something? Or...
Yeah, so to make it like simple, like you take so you have a physical substance. That's the goal with LDI. So it's a little bit different than the purely energetic in terms of the pure information, but in the end result, it is information. So you're taking a substance. So like example, if we were talking about kind of like a hormonal one, so if you have a little bit of progesterone, whatever it is, the cream, you can dilute that. And we use the way we dilute LDIs and make the actual substances is we're still using kind of the classic homeopathy in terms of Hahnemannian dilutions, which means kind of like a 100-to-1 dilution. So that will be a 1C. So we're going in that direction, and when we're utilizing that, we're just consistently diluting down. So after we make a 1C, we dilute it again, take one drop of that, and we dilute another 100 drops of the next kind of dilution down. That will be a 2C, and you keep going down. The only difference between, I would say, LDI and homeopathy in the sense of like where you're thinking in terms of energetics is that when we think of LDI, we think that the more substance there is in there, physical substance there is in there, the stronger it is. But in homeopathy, theoretically, we think the less substance, the stronger it is. The higher the potency of, like if it was a 200C, that would be much more stronger than a 5C. But in this case, we're kind of going the opposite way to some degree. So we're just being mindful kind of that. But in general, that's how we kind of would physically make them. And we would dose them a little bit differently. I think just because maybe of dogma and how we started in terms of how it always worked is that we would use an insulin syringe. So you don't have to inject it. Before in the past, they would inject LDIs. But what we found is it's not necessary. You can give it sublingually because the immune system lives under there in very simple terms. So it gets directly to the immune system sublingually, and it has the same response and reaction. Maybe less than 5% of the population, maybe they need injections. That's what I've heard. I've never injected. I never needed to, but other practitioners, doctors have seen that maybe there's like when it didn't work for somebody, they would maybe inject it and see maybe a response. So, but I would say not necessary at this point. And I don't know a lot of people that physically still inject it for that reason, just because it's so much more simpler. And then there's more of an ability for many more people to do it because people are scared of needles sometimes, right? They get injected. So it makes it much more simpler. So from that perspective, we usually give it, like we said, an insulin syringe, and we're giving around 4 units on an insulin syringe. That's like kind of our standard dose when we're starting something new. And then from there, we kind of look to kind of dose somebody, depending on the response, every 7 to 8 weeks. That would be like if we had a certain like with LDA, the whole way of processing that or doing that therapy is like every 7 to 8 weeks, you re-give the dose for those food sensitivities, for those inhalant sensitivities, or for those chemical sensitivities. With LDI, it's the same thing, and you have to really monitor a patient's symptoms. That's the key thing. It's all about communication, because if a patient takes a dose, you have to understand what kind of response they're going to have, and they have to understand too. Was there a response, a positive or negative one, so we can understand what we have to do next. Just because in terms of dosing going forward, the key thing is that our goal is to find kind of your ideal dose. So we're titrating to the right dose. So a simple example is like the yeast. It has a really broad range in terms of dosing for an individual, because it can be anywhere from like say 5C to over 30C. So that's pretty large, versus like when you're getting something from the pharmacy, it's one physical dose and you're giving that. Sometimes for patients, you dilute it out because they're too sensitive to that. But now we're going with a larger range. So we have to kind of be mindful of how we assess the patient originally in terms of where we start with them. Because if they're very sensitive, then we would go to a much weaker dose, which in this case would be a higher C potency. So like example, 30C would be stronger than 5C, or sorry, 30C would be weaker than 5C. So we would start much more higher for a much more sensitive patient. And then every 7 to 10 days, I still follow this regime. Other practitioners go more quickly, but I've always seen that sometimes after 7 days, people still react. So our goal is within that 7-10 day mark, after they take that original dose, that if there was anything positive, we stop, we assess how much better things were in terms of symptoms, so that we can focus the dose so we can optimize it later on. If there's something if it was neutral, what we do is we go to a stronger dose. So if we start at 30C as an example, after 7-10 days, if it was neutral, we'd give them 29C. And we keep going down in terms of until something hits. That's the goal. So the one part is that people are more afraid of course, and it makes sense, is that if they flare off a dose, because that's what a lot of people hear about, right? In terms of, especially originally with LDI, there was a lot of people flaring because I think a lot of doctors just said, that's a good thing, you're herxing, keep going, which doesn't make sense, especially from this kind of philosophical approach to how we're applying it. It's not just like, it's not a herx timer that you're doing great and you can move forward from it because you're going to feel better after it. You don't feel better after a herx in that regard. It's more specifically that you've hit too strong of a dose. There was too much information given to you. So we have to kind of reel it back and find the ideal kind of core dose. That's the goal. So that's the next stage of after titrating. You're trying to find the core dose. And the core dose is that dose that kind of, that you find that optimizes your symptoms or ameliorates them, makes them better, whatever they might be in that circumstance. And then once you do that, sometimes within a 7 to 8 week period, we give you something called a booster dose. So like if your symptoms got better, say for 2 or 3 weeks, but then they started lingering back and they started coming back, then maybe we can give you a booster dose, which is a much more minimal dose than the original dose we gave you. So example, if we gave you say 29C, we give you 4 units, which now we're doing the math of it. We're saying 100%, that was your baseline dose. But now if we found that we give you a booster at maybe that 4-week mark, we'll only give you maybe like say 1 unit of 4 units of that 29C, which would be an extra 25% increase in the dose. And maybe you need that to be able to get through that 7 to 8 week period where we redose. And the reason why we do kind of every 7 to 8 weeks in the general circumstance of things is because we assume that like the Treg cells are kind of involved in this process, and we have to retrain them every 7 to 8 weeks. That's when they kind of get reborn. So we have to kind of re-give them the information. So that's the key thing behind that. So that's how we kind of get to our core dose. And that's how we use sometimes something called booster doses in between kind of our core dose, taking that. So at the same time, it's not that one LDI or one LDA will cure all your symptoms. Our goal is to see what else is going on and what LDAs or LDIs we think will be important for your case and your symptoms, and then apply those and try to optimize them for your symptoms to kind of bring them down in that regard. If that makes sense.
Yeah, that was great. And what you said about Herxheimer's was really interesting because, a lot of people will say just push through. And would you say that's true for certain treatments, but for LDI, it's not the case? Like, is LDI unique in that case, or do you think there's other things where it's not smart to just push through the hercs?
Yeah, so I'm on the kind of the fence of like I don't want to hurt my patients. I don't think you need to hurt somebody to make them feel better. I think that's the key thing first because if you make somebody flare, they're not going to want to do it anymore because a flare can last maybe a couple of hours to a day to a week for some people or even longer depending on how strong of a dose you gave in them. So the whole point is like even with LDI, if they flared from something that you've given them, then theoretically we can see empirically whatever we gave you create a response in your body. So therefore, it's kind of like an assessment. It's like you're kind of like you're kind of DDXing, so you're trying to like diagnose, but you're treating in a sense almost. Because if they're flaring from something, that means whatever's in you is reacting to this. So if it's yeast, you've reacted to yeast. So something in yeast is affecting your immune system, creating this inflammation in your body. So if we can now dial it down and make it much more weaker, we can find the ideal dose for you there. We can kind of ameliorate those symptoms. That's the kind of goal, kind of overall. So for me, I wouldn't want people to hurt, especially with LDI, because it's not necessary. It doesn't mean you're getting better. In this case, it more means that it's more of an information assessment for me. Like, okay, there's information there saying, yeah, we do have something, but now we have to physically wait 7 to 8 weeks to clean out those old Treg cells, T regulator cells in the immune system, so they can come back, and then we can give them a much more weaker dose, so we can teach them better how to not overreact to what's going on.
And you mentioned the T regulatory cells a few times. So is that one of the primary mechanisms, how LDI works on those?
Yeah, so I think what we assume is kind of happening is we're trying to create immunological tolerance. So that's why I originally just said desensitize. I think it's the easiest word to use. Like we're thinking that something in your body, which is you, is over exaggerating a response towards yourself. It could be. It could be that it's got triggered by something else at one moment. That could have been a microbe. That could have been an allergen in the air. That could have been anything specifically. But now it's overreacting. So our job is to go in there and retrain it. And one branch of the immune system that helps to do that is the T regulator cells, and the most simplest way of kind of approaching it. So that's why we're assuming we're working on that level, because it's not like there are therapies that kind of desensitize and they work on different branches of the immune system, but we're assuming for some reason that this is what we think is going on. Like again, we can't really physically prove it, and because there's no like experimental kind of things that have occurred, but through kind of empirical studies, because like Dr. Schrader has done like I think with over 10,000 patients, he's done studies with just LDA, showing I think it was his effectiveness for allergies and those kind of conditions and food sensitivities was like I think almost 80% or even above or a little bit below. So that's pretty kind of remarkable for allergies in general sense. So definitely we're working kind of theoretically on that branch. And that's where we're trying to create this immunological tolerance. Just because, like we said, we're assuming there's this immune-mediated inflammatory condition occurring. So if we think there's something of that nature happening, then we can, if we know what the trigger is, we can try to desensitize you against that.
Awesome. And do you use this as a standalone, or I'd imagine like in conjunction with supplementation, like immunoglobulin therapy or different things?
Well, in general, like I think I'm the kind of like practitioner that kind of like I think synergy, and I always think in terms of like I have levels of health that we work on with a patient. So I don't usually give it just alone. I think of this as a background therapy specifically, but there are patients who just want to do this, and that's it, and that's fine. So we do that. But at the same time, like I try to think of it because I think we have to be very mindful too that sometimes LDI or LDA, it can take some time to actually for your body to respond, especially if we're titrating to the right dose. Like theoretically, if we think yeast is a problem and we're starting at 30C, but maybe your core dose or the dose that works for you is at 15C, that could take up to 15 weeks to find that dose, right? So that's a long time. So we have to be very mindful of that. But we're trying to be extra careful for those sensitive patients to go slow instead of flare you and wait 7 weeks to kind of retry things again. So whenever I'm doing LDA and LDI, I'm still always doing things in the background. I might wait off 1 or 2 days before or after to start something new with them, just so we know how they responded in that regard. But it's always a background thing that we try to do continuously so we can kind of keep going forward and get the optimal results much more quicker.
That's awesome. Is it something that people could use at home? Like, could they buy a device, um, to do their own LDI therapy at home, or is it something they usually go to a clinic for?
So in terms of the specific LDAs and LDIs, those would be kind of like from doctors in general and
Mm.
practitioners. Just because like part of it, you can like Dr. Tai has his own now. He makes his own remedies of many different things from like even from the foods and inhalants and all the other allergens. But the standard dose stuff from the LDA is from a pharmacy. So you do need kind of a license to be able to purchase that. Um, LDIs, again, like we said, we make them from physical mixtures of something. So like Dr. Tai has made the majority of them that he's shared with the masses and in terms of different practitioners. And they're from like originally they're antigens of different microbes, if you want to call it that. So you need to, and there's a lot of clinical experience around them because originally when we started them, the more people that were utilizing them, the more feedback we would get. So the more feedback we get, the better understanding of how they work or what symptoms they might work with in that regard too. So it's not that you can get specifically LDIs and do them at home because there's also a process of how to take them and how to kind of ascertain a response too as well. But like later on, we could talk about other desensitization therapies because there is things you can do to desensitize your body from different things. This is just kind of one way of doing that, I would say.
That's awesome. What are your thoughts on antihistamines? Do you think they're kind of like an emergency medicine thing, like useful short term but not long term, or?
Well, it just depends, right? Because I always think root cause when I'm looking at a patient in terms of what's going on. So if there's if there's mast cell and kind of like MCAS and all that kind of stuff that's going on, we have to kind of realize kind of why is this inflammatory reaction occurring? Because that's what it is, just inflammation, and that's the body's expression of inflammation for them, releasing histamine. So can we quiet that down, possibly using LDI? I think so. I think it's definitely a possibility. And some practitioners, some doctors use like an LDI of histamine to do that. Right? Even in classical homeopathy, we have histamine too in different potencies to be able to support that. So like I think if it's necessary, people of course always consult with your physician, your doctor to be able to see what works best for you or what might be the best for you. Because in an acute emergency, of course, you need acute things. So you got to do whatever you need to do to quiet that down. But long term, you have to think about, okay, why is this happening? Why is there a reaction? Why is my body over revved or overreacting to this? Why is it releasing such mast cells? Why is it doing that in the general sense of things? So if we can kind of really get down and dirty and kind of and find out those reasons and then work from outside in a sense, then I think we can kind of alleviate that long term, because that'll be the goal, right? Because we can give bandages, of course, and I can do that. I do that a lot in terms of acute things, in terms of acute therapies that can bring symptoms down. That's one of my key goals whenever I have patients. We try to get symptoms quickly down right away as we work on the chronic things, because that gives them more drive to keep going too as well. In terms of like, hey, now this makes sense. Now I'll follow this kind of like this protocol going forward. So in terms of antihistamines, as necessary, people use them. Of course, there's different natural ones that can work really well, but it just depends on your circumstance and what the kind of core reaction is that's going on and what kind of symptoms it's creating, right? Because not just generically you're getting like inflamed skin or you're getting rashes. It could be like POTS. It could be kind of like dizzy spells. It could be many other things too that are going on from that. So we have to think of the intensity of the symptom as well in terms of what type of therapy we need to quench that intensity of that symptom.
That's awesome. It seems like you're really into magnetism and frequency therapy. So I'd imagine like you've looked into EMFs and how they harm the immune system. Do you educate your patients about that?
Yeah, like, so I guess when a patient comes to me, there's a lot of information that I share with them just because I don't think I can tell them about everything the first appointment or even over like 6 months because there's so much information. So I always try to share things right away off the bat, always give them handouts towards these things. And we always talk about it because I do an assessment that kind of looks at the stress of the EMFs on the body too as well. So just to get into better understanding in terms of like Wi-Fi's, things of that nature that can affect our system. There's some people who are more sensitive to that versus others. So always making people mindful of that. And then of course it's their decision what they want to do about it, if they do want to do something about it. But yeah, definitely a big part because like you said, even though you can't see it, doesn't mean it doesn't exist. I think that's the key thing that in terms of our day-to-day realities, we need to see things to believe things. But in the majority of the senses, like especially like you do MRIs, you don't see the electrons moving around your leg or your head that are creating this image, and same thing with like a CT scan, whatever it might be, but it's happening, right? So the same kind of a thing, we're being bombarded consistently, we just can't see it to the visible eye at this moment. But it is affecting us because our body is an electric system. So If you're bombarding it with other signals, there's going to be a miscommunication and dysregulation of that system if your body can't adapt to it as well.
Mm, yeah. And I like what you said earlier about, you mentioned that there's more like anecdotal evidence that these therapies work because there's no money in it, right? For the system to, if LDI blew up, it would challenge kind of the medical system, right? Like worldwide.
Well, like a lot of the therapies that I do, I guess it's a paradigm shift because I focus on kind of like what I've learned in the past, what I've always geared towards as an naturopathic doctor is like biological medicine, integrative biological medicine. I have a lot of mentors in that. I've studied in Europe for it because I was so intrigued by it, and it just philosophically it made so much sense in terms of how to apply medicine. It's not that it's different from naturopathic medicine; it's just a different tweak on it and seeing things. And for me, it's more about I look at things from a regulation part standpoint. So if we can regulate the immune system, if we can regulate the nervous system, we have a better chance at going after whatever is going on in the body, right? Because if those two systems are back on board, then a lot of stress is taken off the body, and now you can properly detox. Now your hormones can get properly back on track, and et cetera, et cetera. So the whole point is if we can regulate systems, then we have a better chance instead of trying to bombard them or try to force them in one direction or another, right? Because we're a dynamic system. We live in equilibrium, and we're in a disequilibrium at some moments, and the body can't adapt to it. And that's what happens, even with EMFs, even with toxins, whatever it might be in today's day and age, it just distracts the body from going back to its basic kind of ability to adapt to those stresses.
Yeah, I watched a video you did on the vagus nerve. It was just a short 2 minute, and you were saying that's kind of central to a lot of things. And if that's chronically like turned off or deactivated, then you can't truly heal. And I thought that was interesting because they make all these vagus stimulators, right? Like you can hook onto your ears and things.
Yeah, definitely. I do use VNS, like vagus nerve stimulation, with patients because it's an easy enough therapy to do at home and safe enough in that regard too. Like I'll be honest, it's a hit and miss for some patients. Some patients they have benefits from it, but others don't. It's so cheap that it's worth a try. So for that regard, but you're right. The vagus nerve plays a big role in many different pathologies. Just because we have to realize where it comes from. Because when we're talking about the nervous system overall, like I specifically look more at the autonomic nervous system, which is the automatic system. Think of it that automatically your heart beats. Excuse me. Automatically you have your blood pressure increases or decreases. Automatically you keep a certain temperature. Automatically you breathe, right, and all that kind of stuff. So the whole point is that there's two major branches in that area. There's that sympathetic branch, which is that fight or flight. I'm going to go fight that bear or run the heck away from it. And there's other branch, which is the parasympathetic, which is that rest, digest, heal, and regenerate. And that's the major branch that's focused, that's kind of innervated by the vagus nerve. So if that branch is off, then your digestion can be off, your lungs can be off, your heartbeat can be off, even like your immune system can be off, because there's different mechanisms involved within it that, like you said, it modulates the immune system. There's an immune reaction. The vagus kind of like turns off for a second, doesn't turn off, but it mutes itself a little bit in order for the infection to be taken care of, right? But now, if you have chronic inflammation constantly happening, and you're affecting the vagus nerve, then your immune system kind of goes into disarray, and then you get these allergies, you get all these things, and then there's a second part to that, of course, which is the limbic system, which kind of like goes back and forth with the vagus, and if one is off, the other is off, and it's inversely in its own sense. So you're creating just this cascade of dysregulation in these systems, which then creates like a hormonal imbalance, which creates kind of like a immunological imbalance, creates a neurological imbalance. So you have like dysautonomia, you have just like this nervous system that's not able to adapt or regulate. Because that's the key thing. When you're in front of a car and you have to kind of jump out of the way, your nervous system jumps in, and also your limbic system. So you have to get the heck out of the way or I'm dead. So every other system in terms of like the parasympathetic shuts off and your sympathetic goes into overdrive to get you out of that danger situation, right? Otherwise, if you were just digesting in front of a car that's going to hit you, you're not going to make it in that regard, right? So that's the whole point. So that's why my key thing always is if we can kind of find ways to get the vagus back online too as well, then that really can support a patient long term, because especially with chronic illness, because that's what I focus in more. I think is complex chronic illness, which can include like autoimmune disease, Lyme, chronic fatigue, fibromyalgia, all that kind of nice stuff that people talk about. It's we have to always be mindful of the vagus, how it interferes or how it interacts with what's going on. We have to always be mindful also of the limbic system in that regard. And we have to realize there's just a dysregulation occurring. That's what it is. The body can't adapt. So it's either in one extreme or another, right? It's either in hyperregulation or hyporegulation. So we have to get it back into a balanced state, because once we can get it back online, like recharge the nervous system, say, then it has more of an ability to do its job in terms of what else needs to be done, right? And there's different ways of supporting that, and that's why LDI is one example of that, where if we can kind of retrain the immune system to take off these insults off the body that are creating this immune-mediated inflammatory response, then the body can actually heal. If you have chronic inflammation, it's like if you have a chronic fire, and you have your leg in there, even if it's low grade, you're going to burn your leg. You're going to keep burning your leg until you put the fire out. The leg then has a chance to heal, right? In that regard, from the original burns that happened. So we have to think that way. So that's the whole goal. If we can turn off that inflammatory state, then we have more of ability to be able to allow the body to heal. And then we can move on to the next stages of what else might need to be done. But for a lot of patients, it's a big part of it too as well. And then I guess just going back to LDI in terms of like the infection versus kind of a debate. So I know, like, I'm not a big kill your way to freedom kind of like a doctor in that regard. I think in terms of both ways, I think you need a little bit of each. There's always microbial loads or even toxic loads that we have to work on. But at one point, things can become, you can become immunologically sensitive to them. So then the question becomes is how much is one or the other? Like, how much of the load is just the microbial part in terms of the microbial load versus how much is it immunological load? That's in terms of an allergy or a sensitivity. Because for a lot of patients, you use LDI and then they can feel sometimes like up to like 80, 90% better in some areas, which is kind of pretty remarkable, right? And even when you're using a microbe, well, there's symptoms like, say they have like brain fog, burning kind of peripheral neuropathies, digestive issues. And then you use the yeast mixture as an example, and then say 90% goes away. So was it a yeast kind of problem in terms of the load, or was it kind of an immunological reaction to the yeast that we're going on? And then sometimes we can even think acute infections. Like, is it an acute infection that's creating the problem, or can we kind of desensitize the immune system that moment? It's a hard one because you can't, it's hard, especially in acute situations. You always want to be mindful and be proper and do what you can to support that patient because you don't want to let things get worse. But even like a simple example would be like a herpes simplex, right? We see like an outbreak, then we say a viral outbreak is happening. But now if you use LDI and that those kind of spots on the lips, those sores go away, then was it kind of a viral load that was created there? Or was it an immunological reaction that affected the nervous system that created this sore? And then that went away, right? So because like a lot of times you can use LDI like HSV towards an acute kind of like cold sore or an outbreak, an HSV outbreak, and you can find that it goes away pretty quickly if you find the right dose. So other people would use antivirals that moment to kind of bring it down, but now you're not using anything to kill it. You're just trying to desensitize the person to it acutely too. So there's a lot to that area, and there's a lot, I think, more to learn in that whole kind of area of desensitization and how much our body is really in that mode versus just microbial load as we kind of go forward. But I think the long-winded answer which I gave is more back to the basics of like you after a long while of even having a certain load of anything, even like metal, like even heavy metals, your body can become sensitive to them. So now it's an immunological reaction against them too as well. So we can't forget that part because you can detox metals, but if you're still creating an immunological reaction, you're still creating an inflammatory response constantly. So until you can desensitize somebody to that thing, that won't possibly go away.
That's a really good point. We had a bunch of listeners send in questions, and one put a comment, germ theory is a fraud. And I think the last 2 years, emotions are high with the world events, and some people say, viruses don't exist at all. And I take a more balanced approach in the middle. And there's this big battle that you're probably aware of, like terrain theory versus germ theory. And do you think it could be both? Because I think the truth is usually somewhere in the middle instead of in the extremes.
Yeah, I'm never an extreme person in anything I do. Like I do believe in like terrain is a big part of it because like you can still kill and people can feel better. And it's true. There's a lot of patients where they like say for Lyme, they take antibiotics and they feel like 90% better. But then 8 months later they relapse, right? So there's something to that as well too. Like that's what we were talking previously in terms of microbial loads. So the question becomes then like, well, are you doing anything else after you start killing, right? Because are you rebuilding a certain terrain where where you're not going to allow for that to flourish anymore? These bad microbes, whatever they might be, viruses, fungi, parasites, whatever it might be in general. Because there's a lot of things we live in symbiosis with that are part of our natural kind of um, like terrain in general that we have to kind of be realize as well. So I think I'm more terrain based in that regard. So if you can change that, then things can't live, and if they can't live, they're going to die off. So of course, like we said, but at the same time, like you said earlier, there's certain amount that people have maybe certain loads that if you can bring them down acutely and give them a little bit of relief, so you can start clearing things out and then rebuild, then that makes sense as well too. So I think it really depends on the patient and their state and where they're at in terms of how you approach it. But I am totally kind of in the terrain based approach. You really have to look at that to rebuild and repopulate and resupport on every level.
That's great. We had a bunch of questions on Lyme disease, your thoughts on Lyme and how you would go about it, like if you had it.
Yeah, well, that's a huge topic, I guess, in general, in terms of where it comes from and where it goes. Because, like, even with every, that's why I think I consider things when I say who do I treat or who do I work with. It's complex chronic illness, because I think if we want to put Lyme in that category, that's 100% what it is. It's a complex chronic illness because there's so many compartments to it, right? People can say then you get MCAS for Lyme, you get kind of like co-infections. Like I don't know where it stops in terms of what you can possibly have with Lyme, right? It's not just uh, the simple Lyme bug, but there's all these other things that are involved with it, right? And then we have to look at kind of like terrain still. We've got to look at kind of like dental aspects of things as well too, because are there other stealth infections or other stealth inflammation places that are occurring in the body that we have to support? So like I always take, like I said, simple, like I said earlier, I look if I can regulate their immune system and I can regulate their nervous system, that's kind of like step one going forward. So they can kind of give them some kind of support and relief. And the key thing with any of these patients, if they're having kind of like neurological pains especially, we want to find ways to give them acute relief. So we definitely focus on acute relief first as we go after the long-term kind of aspects of it, because there's always possible damage that has occurred, right? So we have to kind of think about reversing some of that stuff as well too, as we go in terms of the chronic part of it. But we have to kind of like shut off whatever is happening that moment. And that's where you go back to LDI in terms of where sometimes like there's a Lyme mixture for a reason, because, and we have then the co-infections separately separate out to it as needed, so we can use them. We can use kind of Borrelia, Bartonella separately if we think there's more symptoms toward that. Because I don't think I explained it earlier, but in terms of how do we choose what LDI we give, like I'm still kind of a clinician, so I like to have like thorough kind of like medical history. So I have a lot of questionnaires that I give out in a long, lengthy form. So I try to go through all their history as much as I can the first appointment, and that gives me a good inclination in terms of what's going on. And then the second appointment, we go through a bioresonance assessment, which kind of gives me a little bit more information. And it also, I think it triggers more thought for me, but it also kind of confirms possibly some things that I was possibly thinking. So then from that, we can kind of look through and correlate symptoms in terms of what might be affecting them, like if it's from Lyme or if it's from yeast, different types of symptoms. And those two overlap tremendously when you look at kind of symptoms as well too, in terms of chronically ill patients. So and then from that perspective, when we choose a specific LDI that kind of looks like it would fit, and like we said earlier, we try to find the right dose for them. That's the key thing, especially with the complex chronic illness patients. We have to be very extra mindful, just because we don't want to flare them, because they're already in a difficult state, which is kind of like a lot of them are in a detrimental state of like crucial pain, crucial fatigue, whatever it might be specifically. So we have to kind of do our best to kind of get through the initial part where we can find even a little bit of success to give them a little bit of relief. And that's what we would do with LDI. So as an example, if somebody had Lyme and we give them the Lyme LDI, then all of a sudden 80% of their symptoms went away for a certain amount of time from that, well, then that tells you, was it a microbial problem or was it an immunological problem, right? That was creating that. Because again, these triggers could have happened many years ago. And I think, whenever I look at a patient, I think in terms of insults. I think there's multiple insults that lead to your condition. There's never one thing that created your problem. It's always multifactorial. And I always talk about patients, I say, it's like a cup. Your cup fills up until the end where it starts to spill out. When it spills out, that's when the red flags come up in your body. It says, emergency, emergency, go do something. I'm giving you these crazy symptoms because you got to do something about it. You can't do anything. You haven't done anything yet, so we have to figure things out. And then that's why my goal is to kind of put holes in that cup so things start to spill out, so the burden is less right off the bat. That's kind of the key thing. So if we can get some relief by putting some holes in the cup to drain it down a little bit until we kind of get to a certain point so that we can kind of give them some relief, then that's kind of like phase one of what we're trying to kind of achieve. So for like Lyme, we look at it like multifactorial. I have to look at every level of it. How's their immune system working? How are their hormones working? Because you need an anabolic effect to rebuild as well too. And if their body's in a specific sympathetic overload, which a lot of people these days are, especially chronic illness, because their body's just always over-revved, especially the nervous system, then how can you heal? You can't. If your parasympathetic is dumped, which is that rest, digest, heal, and regenerate, you're not going to be able to regenerate tissues if your body doesn't have the ability, because it's forced into a sympathetic state, into a crisis state 24/7, right? And then again, you need the anabolic effect. So you need to have some kind of hormones on board to be able to build as well. So you need both factors. You need to have a certain parasympathetic load or a kind of level that's going to put you into regeneration. But now you need the tools, which is the physical hormones, to be able to do that, to be able to build up those tissues back. So there's different ways, of course, of doing that. But that will be kind of like the basics of how we look at it. And then we go after different things because, of course, there's molds, there's toxins, there's all these different things involved with kind of complex chronic illness. So we can't forget the simple things too as well. Because I think a lot of people forget about simple home therapies that can go a long way. I get every patient to do castor oil packs. I get every patient to kind of like do contrast showers. I get every patient to do kind of like even alternating foot baths for their headaches. I get every patient to kind of apply lymphatic cream on their neck and their inguinals. So there's simple things that you can do at home that don't seem like they're going to be big at this moment, but it's more about an accumulative effect. That's what we're kind of looking for. So over time, why not do something than nothing? I think that's the key thing until you see me next in that regard. So if you can kind of start supporting yourself, then that's going to make even the therapies we do in office more effective and more supportive for you. So you can kind of find your or reach your optimal health goal.
That's great. Have you worked with patients with parasites? I think some people think, they don't have proof that they have them, but they feel like they have them. And do you think that's a common thing caused by like low stomach acid or a suppressed immune system? Or
well, yeah, I think I won't make a generalization, but I guess a little bit. I think everybody has parasites in some degree, right? Because we live symbiotic with them to some degree, and even with like when you're outside in the dirt, it can easily get into you, even in your fingernails and all your toenails, whatever it might be. And especially if you've gone to endemic areas that there's a lot of parasites, you'll pick something up, even from foods, all that stuff. So it's definitely possible, and it definitely is part of the thought process behind it too, to be mindful of that stuff too. Because some people, under their school of thoughts, that if you can get through the parasites, you can get through to the next level, right? Especially with allergies and all that stuff. And it is true. They can create more allergies. They can create more of a Th2 response, which is more of the allergy response. They can increase eosinophils, and sometimes even on regular blood, like CBCs, you can see that as well too. But again, I don't think you just kill your way to freedom all the time. Because I've taken courses too about parasites, and I respect a great doctor, Dr. Yu. People call him the parasite guy, parasite doctor. Like he still has a program around it. It's never just like you kill and then you're done. Like even with him, like he's strategic because he's a retired kind of like, I think, Army general or Army colonel of the U.S. Army. So like he knows there's strategy involved. There's warfare for him, but there's also kind of like the other areas you have to look into, which is for him still dental's a big part, and you still have to kind of do other things to support around that. Because I think if you just go into killing with whatever it is, from parasites to microbes, and your body's not ready for the debris that might be left over, it can create other problems. So we have to be mindful. So I think for me too, a big part is also drainage, or opening up the lung trees, or opening up the drainage pathways. So your liver's working effectively, your kidneys are filtering effectively, your lungs are working effectively to release the carbon dioxide, which is, I think, one of the most poisonous things in the world that we don't realize, because you can die if you have too much carbon dioxide in your body, right? In that regard. So we don't think about that in that regard. So if we can get the organs of elimination working, then we can kind of really do a lot of stuff. And then we can start going after those things so that when we release toxins, whatever it is, from like exploding a microbe or anything else, then they have a way out. Because, for example, if you kill yeast, we know that they can harbor metals, especially mercury. So sometimes yeast is not a pathological thing, but maybe it's protecting you. Have you ever thought about it that way, where it's a protective mechanism because metals are going to hurt you more? So they're building up the yeast. Yeast is taking over the metals. But now if you go and kill them, you're having this die-off, and die-off maybe could be from recirculation of metals. And if you have a leaky gut, you can very easily, and you probably do have a leaky brain. So if you have a leaky brain, things will then go up there. And then what happens then? You get other symptomology that will occur, right? Then things get stuck in your brain. So we have to kind of clean that out as well too. And the biggest thing, going back to the vagus nerve, think of the vagus nerve as the escalator from the gut to the brain. So microbes can go from the gut to the brain and vice versa. So if you have a dysbiotic brain, those microbes go down to the gut. If you have a dysbiotic gut, those microbes have the possibility to go up to the brain as well too and create havoc. So it comes back in terms of those basic things, in terms of the lymphatic system, which is like your lymphatic system of the brain. You got to get that moving as well too, so you can kind of get things draining. Because I think for me, the majority of pathology is from the neck up. I think that's the key thing for a lot of patients, especially chronic patients, because that's where everything's occurring, right? And the brain and the mouth. So if we can kind of get those things moving and those things clearing, because if you have an impingement in the nerves, or if you have kind of if you have a structural issue too as well up there, you're impinging those nerves because you have your cranial vault. So you have little holes in the cranium where nerves come out. But if those are kind of like pushed against, or they're not coming out properly, and they're getting irritated, they're getting inflamed, they're going to have downstream effects as well. And then you have the same kind of idea with the venous system up there too. If you have poor venous flow, then you have poor drainage from the brain outwards. And then if you have backup, of your toxins and garbage that has try to come out of the brain, that's not kind of leaving properly now. And if you don't have proper flow into the brain of blood too, then you're having other problems as well. So we always have to think in terms of that. And then sometimes structure can be a big part of that for some people, where the oral pharyngeal space, that there's narrowing of that palate. And then that can put stress on your nervous system, right? Because if it's irritating now your vagus nerve, now it's irritating your autonomic nervous system, which controls your speech, which controls your breathing, which controls your heart, digestion, all that kind of stuff like we talked about earlier, right? So, and then it can put into a chronic state of inflammatory responses that can be continuously occurring. So for a lot of people, if you can kind of maybe even just, if they have a structural issue and support that can put your nervous system back online in a positive way, bring down the sympathetic dominance that might be occurring just from that. And then again, then you have poor drainage. So we have to think of all these different things when we kind of look at what's going on with an individual from Lyme to anything else, so we can kind of better assess them and better treat them long term.
Those are great points. Yeah, I think sleep is overlooked, right? Mm-hmm. And I think Elon Musk wants to launch like 42,000 satellites in low Earth orbit. And I think the more those go up, the more insomnia people are going to deal with. And maybe, those Faraday cage bed canopies are going to blow up. But yeah, if you can't sleep properly, then you can't do that lymphatic flushing that you talked about, right?
Yeah, exactly. There's a lot of studies. It's like power washing your brain. Sleep is like power washing your brain. And even I think there was a study a long time ago, which I could be wrong, so don't quote me on this, but I remember if you give a bolus dose of anesthesia, that's like cleaning your brain out too, if it goes to your brain. So we have to clean that. We have to kind of get the junk moving, right? It's like anything in the body. You have to get the nutrients into the cell, but you also have to get the toxins out of the cell. And that's why sleeping is a time where all energy goes to detoxing the cell, in the simplest way of kind of approaching it. Because when you're up and at 'em, you're using things to move and to energize and to focus and all that kind of stuff. So all your energy is towards that area.
Mm-hmm. So wait, so you were saying anesthesia helps the lymphatic or inhibits it?
There's one study I remember I read before in terms of like under deep anesthesia. It was, I don't know which specific anesthetic, but there was something there. I have to look it up again, but I remember that because you're putting your brain into like kind of like a calming state, if you want to think of it. Wow. It's like a sleep state, right? That's what you're doing in a sense. So then the lymphatics can kind of turn on. Same thing with sleeping, right? So that's why even 10-minute naps can be helpful too for a lot of people.
That's pretty cool. Yeah, if I'm ever underslept, I use my new calm, and there's all different types of, you know, there's neurofeedback and all these different things
Hmm.
um, that are useful for that. But yeah, I feel a lot of people's brain is just tired, right? It's not getting full regeneration at night.
Yeah, because we're always in a go 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 state, right? I think, well, luckily you're in the forest, like you said, so you're maybe a little bit more of a calmer state, kind of on a day to day basis. But then average individual living in a city, they're always on the go, right? And especially now with what's going on, people's limbic system is off, people's nervous system is off, right? Because you're always in a frightened state. If you're always in a frightened state, how can you go back to rest, digest, heal, and regenerate, right? You can't do that. So it's impossible. So your body's always over revved, so your brain's over revved. So everything's hyper-regulating, or things are just literally turning off in your brain, and you can't focus, you can't think. So all these things are important. That's why, like you said, sleep is so important for that, to be able to get the rehabilitation that your body needs as well.
Mm. Um, Kind of a off topic. Have you experimented with like Rife frequencies, like Spooky 2? I know you use like frequency specific microcurrent, which might be different. Like I've used like, the micropulsing the blood, and
Hmm.
I have like a plasma Rife machine here, in my office. And have you had success with patients and Rife frequencies or?
Well, I think, like you said, like bright frequencies are just a certain range of frequencies, but there's so many frequencies out there, and like you were saying earlier, that I do frequency-specific microcurrent, which is kind of like we found correlations with many different specific frequencies. But to be simple and just to so people understand, with frequency specific microcurrent, it's a little bit more different where you're using two inputs of frequency at the same time. One is for a tissue and one is for a condition. So in simple terms, if we think you have inflammation in your liver, we're going to put one channel for your liver, and we're going to put one channel for inflammation. So you can quench that inflammation. So that's what's a little bit different. But again, the whole kind of like process in these frequencies, they've been like, I guess, kind of been there for like over 100 years, right? Same thing with Royal Rife and all that kind of stuff. So it just depends. And there's microbial frequencies, like, and that's what you're kind of talking about with the Rife ones. They're a little bit higher up there. I don't say I specifically use Rife. Like I have, yeah, I do. We do have Rife machines and things of that nature. But I would say I use more of bioresonance as needed, and we have different tools where we're using frequencies to kind of go after it. And you can use Rife frequencies on different tools that we have. But the simplest one would be the frequency specific microcurrent, where like I think of it as a manual bioresonance, because even with these Rife machines, unless you can kind of like automatically or assess an individual, it's hard to choose which frequency to input, right? And the same kind of idea with even with FSM, frequency specific microcurrent. We have protocols towards different things, but again, it's about the individual in terms of how they're going to respond. Because when the person does respond to like FSM, they get dwarfed because there's like these there's a dwarfing effect where they kind of get high or they get really tired and kind of sleepy. So we know something's working kind of right away. Or we can see a response kind of pretty acutely too as well with them, where like on the table after utilizing the therapy, they can have a change in symptoms, right? So if it's like the simplest example is be pain. Like I have a patient who had like back pain, it was like a 9 out of 10. By the time they got off the table, it was kind of like a 3 out of 10, right? So we know right away that there was something there that we used in terms of those frequencies that supported their state. And then we know, like, so if I thought that the frequency pair that I used was only for emotions and that helped their pain, but it wasn't their lumbar disc frequency, then we know there's an emotional component to their lower back pain, right? So it's pretty cool in terms of, like, I think I use a lot of therapies that are kind of like they're a tool in terms of a diagnosis and a treatment, because I'm hypothesizing in terms of what might be occurring. And then if there's a clinical effect, then I know that was part of that hypothesis. So then that's possible diagnosis of some kind. But we don't, of course, diagnose people just on that, but it's more about like, I know there's something involved with what we just inputted into that person. Because that's where it comes back to like information therapy. And I think that's where LDI kind of shines. It's a type of information therapy, because even with LDI and the different potencies that we can use for them, at one point when we dilute it down to a certain point, it's past Avogadro's numbers, which just means very simply that it's past having any physical substance in that medicine at that moment. So the whole point is that now you just pass on the information. So the whole point, now you're passing on the information to that patient, has nothing physical theoretically, if we're looking at that from that perspective. So it does something to them. Therefore, it's that information that was passed on that did the job versus the physical matter in that kind of like sample that we give them, or in that dose that we gave them. So I think I always look at things as like biophysical information therapies. And if we can kind of like give the information on to the person that they need, then that can do it. The body will take it in as needed in general.
That's awesome. We had some more questions on LDI. Like, how do you know your body's ready for it? Can you start at any time? It sounds pretty safe.
Yeah, you can start at any time. I think the only thing was when there's a difficulty in getting a response. I think the biggest thing is like there could be like a huge toxic load, or there's something else that's blocking you, because of course toxins can block pathways and all that kind of stuff as well too. So even immunological pathways they can block. We know that. That's when you can create allergies, right? You can get metal allergies and all that kind of stuff. So we just have to think about that as well. I don't see it too often, but there are some states where you want to kind of, that's why I always do it in the background. So as I'm doing other things, I'm doing LDI just because I'm cleaning them up as we're going. We're opening up the organs of elimination. We're getting things flowing, because like even like think of the gallbladder, right? That holds a lot of toxins, a lot of microbes, that sludge, that bile. So if we can clean out and thin that bile out, we get proper flow, and we get less stagnation and less things that shouldn't be there being stuck there too as well. So for LDI, it's safe enough to start at any moment. You just have to kind of like assess the patient, like saying, do you want to go really slow? Do you want to go extra cautious, so we go extra weak? That's the only thing. And then if we can do that, and if they're comfortable doing that, then it's just a matter about the timing of it, how long it'll take to find the result. But it's definitely safe at any moment. I would never like force a patient to kind of like go hardcore just to get a response. Because there's some practitioners that, we're like, let's take the strongest dose so we can see if there's a reaction to this medicine or this microbe as an example. So then 7 weeks later, we'll go and find it. But right now, we're just going to go quickly and say, like if you reacted, like say to like cytomegalovirus, then bam, we know that something is reacting in you. So we're going to wait 7 weeks and then redose you, kind of thing. So we don't want to do that. I don't do that. Some patients really want to do that for some reason. I don't know why, but I avoid it, and I try to explain to them that's not the best approach. But if they want to, I'm always open in terms of, because I want the patient to be comfortable too in terms of what we're doing and why we're doing it.
That's awesome. We had a few questions on low dose naltrexone therapy and your thoughts on that.
Yeah, so it is quite different, right? It's a whole different therapy. I think the only thing I would say with LDI, like so I can compare it to it, because like getting to like, I'm not an expert in that at all, so I don't want to just kind of talk about that. But I would say it's another way of kind of like modulating the immune system for sure. So the whole point is like, now the key thing with LDI is you have to have some kind of symptoms, right? If you don't have symptoms, then it's hard to kind of differentiate what's happening. So like if you have a symptom that we can kind of like showcase a change in, then that gives us kind of something to kind of like something objective or subjective, or whatever you want to call it. Like an objective finding would be more of skin, right? There's a lot of examples I can give of skin conditions that have changed using LDI. So we know it's objective. It was big before, it got small now, or vanished. But in terms of like pain, it's subjective, right? To some degree, we try to objectify as much as we can, but they have to have a certain symptom to be able to kind of showcase a change. So that's what I would say in terms of that. And like low dose naltrexone, like if you're using that as an example and then all your symptoms go away, it's not really the best thing to use LDA or LDI, because now you have no symptoms to track, right? So you want to have, because the whole point is like when you get off low dose naltrexone, will you have symptoms again? Possibly. So the question is, then you can start utilizing, because then you have a better chance of understanding. You can always use in the background like LDA, at least like for allergies, if you know you have those, but you want to see a change in some kind of symptoms. You want to see something you can track. If there's something you can track, then it makes it more accessible to understanding if something's working.
That's awesome. Nick, is there any way they could take a break on the drilling in the background?
I know, I apologize, just because there's for today, and especially literally in front of my window today in my office, they're fixing signs.
Oh, okay.
So it's literally the people outside, so I can't control them.
Oh, that's okay. It sounded,
right now, I know
it sounded like it was in your office. That's all right.
Because I have my window right now. Yeah. I apologize about that. I know I'm trying my best, but I'm trying to speak louder if I can too. But let me know if you can't understand me or hear me in general.
That's all right. Yeah, it's still come through. Can vegans be healthy? Kind of a funny question. Do you work with any vegan patients, or?
Yeah, like I have a lot of vegan patients too. Like, I mean, not a lot, but I mean, definitely work with vegan patients. And it's not that they can or they can't be healthy. I think diet's a huge area, right? I think for a lot of people, and I think you've known this too, going through your own process of different diets. And it's like things work for some people, right? Different things, people's body adapts differently, right? And so I don't judge. I just think like, hey, how do we support you? And if this is working for you, okay, great. Let's optimize it. But if it's not, we have to rethink it as well too. Like I'm not against meat, but I'm also not for meat every single day as your only meal as well. I think everything in moderation makes the most sense to me. But again, it comes down to like what works best for that patient. Because sometimes people can be carnivores and they work amazing for them, right? Sometimes people can be vegans and it literally changes their lives too as well. And I think short spurts of some kind of diets is a good thing too. It can be helpful to get you out of a certain state, but then it's more about long-term sustainability of something you have to be mindful of. So hopefully that answers the question of if vegans are healthy or not.
Yeah, no, that's awesome. What are your thoughts on colostrum? Someone asked if it's wise to use colostrum on autoimmune conditions when IgG is already high. Have you used that with patients at all, or?
Well, I use like whenever I use, if I'm going to use something of like colostrum, I go specifically to a product that's more, I guess, safer. But if people are more worried in terms of like autoimmune and all that kind of stuff, then using like maybe an IgG formula, like that's from like the serum bovine versus kind of like the colostrum would be a better choice for them. That's what I would say in that regard.
That's awesome. Let's see if there's anything else here. Do babies inherit their parents' T cell information? Like, do we get our immune system foundation from our parents, I guess?
Well, I think to make it more generalized, I think you get information from your parents, of course, through genes, but also kind of generational things too, right?
Mm.
So that can be some information imprinted on the immune part of your system, or there could have been some kind of trauma at birth that can kind of maybe suppress the immune system and create this outlook that's allergy based or whatever it might be. And also with autoimmune kind of conditions in general, where there's always an emotional component. I don't mean just the physical, psychological, emotional. I mean there's because I don't like when people just say, oh, it's just in your brain, it's just in your mind kind of thing. You're just going to be anxious. No, there's physiological change happening, but there's also an emotional component where there's blockages of information flow in the body. They can be like, from example of a physical thing, like a scar. A physical scar can be an emotional. There can be emotions to that because maybe you were you were robbed and somebody cut you with a knife, and whenever you think of that scar, it brings trauma or shock or fear, and then all of a sudden you kind of say like clear that scar, which there's different ways of kind of doing that, but like simply put, like now you're allowing the proper information to flow through that. People do it differently. You can do it energetically, where you're kind of like trying to allow the proper information, that cells to kind of get back into regulation so proper information can flow. And then people start crying heavily and they don't know why, or that emotion comes back up, or that burglar's face comes back up, or wherever it might be, that moment, just because you worked on that scar, you allowed that information that was stuck there, that shock, to be released. So even with any therapy, it's like I've had patients who like randomly, spontaneously would cry or laugh after a therapy, after we work on an interference or a blockage. And that can be from like any specific thing, but like to make it simpler for the audience, like a scar can be one part of it too as well. And then back to the question of like, I think there's a lot of generational stress that can be put on an individual through their genes, and like you were saying, even to their immune system. So it definitely is a possibility, and you always have to be mindful of that too. It's like, because there's generational traumas that we're unconscious about, right? That flow through. So if we can work on those in different ways, and that's, I guess, more complex because there's different ways of looking at it and how you approach it, but just being mindful is the first step towards going after it too.
That's awesome. And earlier in the show, you mentioned that there's other like desensitization therapies that people could do at home. Can you go into that just for a minute? Like what people can do?
Well, yeah, I think there's a lot of different tools and therapies, and if people who can get tools to have at home, like you're saying, Spooky is one example of a tool. I think it's sometimes complex for a simple individual because you have to really do a lot of manual stuff and really learn yourself. But if you're a whiz and engineer, I think it'll be like the most amazing tool you can ever have, possibly, right? But there are simple tools that you can do. But I think going back to just like other ways of desensitizing people, it's like energetically we were talking about, like I think you were saying earlier before we started chatting here, is that like you can graft things. So There's devices that allow you to graph either an inverse frequency of the actual substance that you might be sensitive to, or you can kind of desensitize, say, your blood or your saliva or your feces with the machine, where they can give you the inverse frequencies of that, and that can be a way. There's other blood therapies people do to kind of do that, or even people do urine therapies to desensitize themselves too, like in India and other countries. That's a big thing too as well. So there is a lot of things, or there are a lot of things that you can use. Sometimes they're devices, sometimes they're just like diluting them out into a homeopathic kind of amount of a substance to be able to kind of do that. I just use LDI because it's more focused for me, and I know kind of it can work, and there's I've seen kind of like clinical results, so I focus on that. But I do have machines where I can make a remedy for an individual, for a patient, based on themselves too, on their DNA or their information. So definitely that's another way of kind of desensitizing. There's so many different ways of doing it. LDI is just one example of it, right? Because we're using a physical substance in this case, but otherwise you can graft information. If you have like plates, like you were saying before, like a device that has two plates, an input and an output, where you can put whatever you want in the input valve or plate, and then it'll take that information and put it into the output kind of vial, right? And then you can take that and support yourself. And some practitioners and other colleagues, and sometimes I do it myself, I'll put it into a kind of like a tincture, or I'll put it into another homeopathic remedy in terms of whatever I think might be important for them to kind of desensitize, especially when they have colds. Sometimes we'll take a little bit of their saliva, whatever it might be, and graft it into like a remedy that works for colds in that regard too. So there are many different ways. It's just kind of, it's hard to say like all of them that are available, but there's manual ways, like you're saying, like even you can do it at home. People, like I said, do urine therapy. Other people kind of like just take their saliva and dilute it down themselves. So it just kind of depends. And if they have devices, I think devices are becoming more affordable, where they're called like infoceuticals, where you're making, it's just information, kind of like medicines, right? That you're giving yourself. So there's a lot you can kind of do in that realm for sure.
Yeah, it's funny you say infoceuticals. I was going to ask you if you've heard of infopathy. I interviewed the guy that invented it, Anton, or that came out with the technology. Basically, it's just a plate that you connect to your iPad or your phone or your computer, and you can run frequencies of substances and imprint that into the liquid, water or milk or whatever it is. And I think once you've had experience with these technologies that seem so esoteric and like they shouldn't work, like I gave it to my family back in California, and like all of them are skeptics because I would do so many different things, and they all felt it. And I gave my dad like a male hormonal cocktail, and he like had trouble sleeping. It's like, like testosterone, DHEA, and all this stuff. And he felt great the next day, but gave him too much of an energy boost.
Yeah, so you're right. Like I've heard of that. Like I haven't looked into like too deeply, but like there's just so many of them in terms of different ways of just there's little tweaks on them, because like you're saying, people, I think the goal is to try to make it as affordable and easy and accessible for people, right? So if you can kind of do it through your iPhone or whatever it is through an app, which is great. But then I'm always mindful of dirty kind of EMFs and all that stuff and frequencies putting through. Like at least when you have a certain machine, there's analog like signals coming out that you want sometimes to be able to get that stuff going. But yeah, but it definitely can work. And I don't like, yeah, I think there's so many out there, and that's one example of it. And definitely, I think that's great if people can use. My goal is always to find ways for patients to do things at home. So if there's things of that nature that they can do at home, that's going to consistently support them, and it's easy enough that they can drink water that has information in it, that's amazing, right? And it makes their lives easier instead of like doing a cocktail of other things. So it definitely makes sense in terms of even long-term health. So longevity-wise too, if you can do things that are going to support you, I'm all in for that, if it makes sense.
Mm-hmm. Have you found a lot of patients have like mineral imbalance? Because I've been looking into like the cause of like, chronic fatigue syndrome and just low energy. And I think a lot of it could just be like potassium deficiency, salt deficiency, whole food vitamin C deficiency, and maybe magnesium. And they just don't have like these spark plugs in place.
Well, I think you're right in that regard. Like, I think like the majority of my patients, I always put people on minerals right away, just because even before vitamins and all that stuff, just because, look, when you're in a chronic state too, you burn through your minerals. Like when you're in in a like sympathetic dominant state, whatever it might be, you're just burning through stuff. If you're toxic, you're burning through them, right? And like then your body's using its resources, which is through your bones and whatever it can, just to kind of get through the day in that regard. So I think definitely minerals are a big part of it. Then we have to kind of then look back here, why is your body in such a state, right? So then again, going back to the root cause and trying to figure that out to rebalance and regenerate what's going on in order for your body to go back into a basic regulation state that it can intake and assimilate minerals properly. I think that's a key thing, because I think we can't assimilate stuff, right? Like you said, like even like with toxicity in the world today in terms of glyphosates and all that kind of stuff, everybody having like leaky gut, the generic term, but it's not going to allow you to properly get things in as well. So that's a hard part. And then we have, our soils aren't the greatest as they used to be in terms of what the nutritional value there and the mineral content. So, and there's a lot of things in there that it's actually going to bring our nutritional content down, right? So we have to be very mindful. So there's so much to it, but yeah, definitely I think people have mineral problems.
Yeah, we were just watching a video of a permaculture guy named Jeff Lawton that I had on the show, and he made a good analogy on a chalkboard with a grocery store, and the aisles were different minerals. Like one was magnesium, one was iron, one was NPK, and he was saying that pH is what opens the grocery store doors, and if the pH is off, then it actually restricts access to different aisles or different minerals. So the plants can't actually uptake minerals if the pH of the soil's off. I thought that was kind of a cool way to think about it, an easy way to understand it.
Yeah,
and
definitely.
that applies to the body too. If the pH of different tissues are off, then can't utilize minerals.
No, and you're right. And it goes back to voltage, right? We're electrical beings. I think we always forget about that. We always think just biochemically, but we have to think physics as well. Because if we don't have the proper kind of voltage going, you can't open that voltage gated channel to be able to get things in and things out. You can't have that biochemical reaction without that energy involved, right? So we can't think of just biochemistry the whole time. We have to think above. And that's why I think these energetic devices, which are kind of looking at the quantum level of physics, I know we don't know enough about them in many ways, but there are a lot of studies and information in quantum physics. I was a chemist before, and I remember like quantum chemistry was like really cool for some reason. I don't know why. I was really intrigued by it and all that kind of stuff, because I was an organic chemist, so I really loved making stuff in that regard. But I remember when I started to understand it, like it just started to make more sense, the bystander effect in that regard, and just understanding that you're not you have to kind of look at things from a top-bottom approach sometimes too, in terms of where your body needs the voltage in order to create those reactions that you're depending on in order to survive. So if we have the proper electricity, we have the proper electrons in our body, then we can kind of get through that. We can kind of optimize our outcomes as well too. So like I think you were saying earlier, and PEMF can be helpful towards that as one part of it, but we have to recharge ourselves in many different ways, and just even grounding, all that kind of stuff, getting dirty electricity out of our bodies too as well, and then recharging with different devices or with different kind of foods or whatever it might be. These are different ways of doing that, right? So simple things for people to do at home as well.
That's awesome. Yeah, it's a good point too about physics. I think I got into light, water, and magnetism, in Jack Kruse's work years ago, and he's like, I said cold therapy is not a biochemical effect; it's like a physics effect, and that's what I used to do ice baths and stuff, and I had to work up to in the winter cracking the ice in my lake and jumping in. Not quite there yet, but it makes sense that it's affecting the water and the exclusion zone water. It's increasing the gel water.
Yeah, you said like the structured water that takes on information much more effectively, and then that can be passed on to your body more effectively. So we have to think of it that way, like when we're talking about structured water and all that kind of stuff. So it definitely, like, I think it comes back to simple, like that's why I keep saying information therapies. It's like if you can get the proper information to the body, you can get the proper cyber energetic regulation happening in the body, right? So because there's just tweaks and blockages that are happening, and if we can kind of alleviate those, then we can get the system back online to do its job. I think that's what it comes down to. And same thing with LDI. That's why if we can take a stress off the body with an LDI, that's creating this kind of constant chronic inflammation in the body, then we have the body then finally has a chance to heal. And there's a lot of examples like of where it works, where I've seen I would say the only time, just going back to LDI for a second too as well, is that the major times when LDI won't work, we have to be honest with ourselves too, is when there's a physical structural problem. So if somebody has like rheumatoid arthritis and they have deformed fingers. LDI is not going to change that, but what it can do possibly is stop the progression, just because now we shut off inflammation. So no more inflammation in the area means no more kind of constant degeneration of those fingers or whatever, those joints. So, and same thing too, like if it's a genetic issue, we can't say that it's going to change that genetic issue on its own, because our goal is to say that there's an immune-mediated inflammatory reaction in the body, then we want to shut that off, whatever we can, or mute it as much as we can in that sense. So like an example of like LDI where some like success stories, and again, I'll just disclaimer, like some of them are like they can work really amazingly, but it's not everybody, right? It's not like it's not always an overnight success. But I've had a patient, I'll be like with like more objective like kind of data, was like he had a skin condition, he had psoriasis, but he also had something called guttate psoriasis, which is kind of like drops of like psoriasis on the chest. We know there's correlations in the literature of strep possibly causing guttate psoriasis. So I had a strep LDI, and we gave it to him. And then within like the next 1 or 2 days, like his guttate psoriasis literally kind of left. It was gone. And then that lasted about like 3 to 4 weeks. So then in 7 to 8 weeks, we give him a redose. And then since then, it hasn't come back. And that's been like 3 or 4 years. So it tells there was a trigger there, and the strep was a trigger, and we got rid of that. And then that kind of like symptom or that skin condition went away. So, and like another one too, like even just like looking at, I guess everybody knows like what warts are, right? And we think warts are always kind of from a viral component, right? That's what we always kind of assume. So that, like, I'll just put this out there, but it was really interesting. I had a child, and they had some warts. They had warts around their lips. They had warts on their thumb, a really big one too. And I gave them a LDI to start off with for foods, because they also told me, like, they didn't tell their parents, but they told me that they had like really painful stomach pains that never complained about it. But so even the parents were shocked when they heard their child say that. But we gave her the food LDI, and I gave her, of course, some other things too. Like I said, I don't just give one thing. But within a couple of days, the mother got back to me later on saying that the wart was completely gone, and all the warts were gone on her body, especially the big one that was like seen on her hand in a sense, and on her lips and all that stuff. So now the question is, was it a viral reaction or was it a food reaction that triggered the immune system towards that, right? I don't know. People can make their own decision, but that was interesting in that regard too. And then there's like a lot of other examples just from basic allergies. I think people were asking about that too in general, like chronic sinusitis when using like the inhalant allergen and even the food mixture. Those are two things. I had a patient really bad at chronic sinusitis. He was kind of like he worked like night shifts and all that kind of stuff too. And he had to go like into like rooms that were kind of like sometimes filled with kind of like different dust, different molds, even like sometimes into like places with like animal dander. And he was really sensitive to, I think it was cat dander mostly. And he'd have a horrible cough where he's corking up stuff all the time. But with like the LDI mixture of like IC, which is inhalant mixture, and with the LX mixture, which is just a low dose of the food mixture, we were able to get his kind of allergies like 80% better, kind of right off the bat. So he realized when he had to rush into a room with like a cat, in a sense, that there is no coughing hysterically at all, even though it was an extreme room, like with like dust and all that stuff around him. So that's interesting in general too as well. And then examples of like even like utilizing say the hormonal part of LDI. So even like a more recent example with a patient, they had like a premenstrual dysphoric disorder. Just means like think of it like really bad depression before their menses in that regard. I mean, it was really intense, like very intense for them too, because they've had it for so long, and nothing would really help. And we started them with LDIs, like their symptoms started to get better with like just the general ones. But then I told her, okay, before your menses, take the estrogen LDI. So she took the estrogen LDI, and then within that cycle, her kind of like her depression went away by 90%. So it was pretty like intense, and her headaches too were gone. So she was like, life was livable, if you want to call it that, for her. So it was really intense. And another example, even of another kind of patient with pretty severe like PMS symptoms, and the biggest one was like she was overly emotional, just crying at everything, needed to sleep like probably like 14 hours just to kind of get through the day, and heavy bleeding. And we gave them again the estrogen LDI, and like literally her symptoms and her mood, everything changed by like 90% better on average for a lot of things. Like her breast pain was gone, her spotting was like 85% better, her mood was like 80% better, like pains in terms of other like ovarian pains, whatever it might be, that was like 80% better. So there's literally something to it, and it's really intriguing for that reason when you see these kind of like extreme examples of what can happen. And even with food, an interesting example with the food mixture is like patient with pretty severe vertigo, gave them the food mixture, literally their vertigo got better by like 80%. So it was like almost completely gone. It wasn't a bothersome before they would vomit, like if they had like an episode. So you can definitely see how it can work in different ways. And when we go towards the microbial ones, we also try to look at research in terms of what's correlating to research. Like an example would be like Hashimoto's disease, right? Thyroiditis. We know in the research there's two possible microbes that can trigger that. And one is like EBV, Epstein-Barr virus, and another one is also Yersinia. So what we can do sometimes, like to hopefully help support a patient in that kind of condition, is that we can give those LDIs. And we can, like, the way to monitor that sometimes is looking at their antibody titers, right? If we can look at that to kind of better monitor in terms of like if we can see a shift in that regard. But that's one correlation. And same thing with kind of like rheumatoid arthritis. There's specifically there's a LDI for that we have, which is it's called Proteus Klebsiella. It's both of them. So Klebsiella we can say more for rheumatic conditions. Whenever I think of a rheumatic condition, I think of Klebsiella for my patients too. So we always try that out. And that can be very helpful towards like the joint inflammation and pains of that nature. And I have seen it with different patients. It doesn't always work with every patient, but there are correlations of Klebsiella even work being correlated to, like I said, just in general rheumatic conditions. So we always kind of think of that kind of stuff as well too. If we have a definitive diagnosis, like say like rheumatoid arthritis, if you're checking specific kind of autoimmune markers, like anti-CCP, I think it is, then if that's positive, then possibly this LDI could be a good one for you to try. And so we always like think about it that way as well, kind of as we go forward and what we think would be the best for that individual. And same thing too, like I even had a patient with the yeast mixture to make it more broader. They have kind of like a severe chronic fatigue, and they have like post-exertional malaise where they try to do any kind of exercise, completely exhausted, can't move, debilitated for a couple of days possibly. We did the yeast mixture, and then that literally brought them alive by 80% in terms of their fatigue. So we know there was some kind of trigger there, right? I'll be honest, but they did crash again. So we know that we're close, but we know there's something there directly. Now we have to kind of like tweak the dose to be able to optimize the effect for them. But it tells us there's some kind of immunological trigger to yeast that's creating this kind of fatigue, because some of these patients, they've done so many things, and things just haven't worked for them. So the question is kind of why. And it's not that they did the wrong things. I think sometimes it's all about timing for an individual. It's all about properly aligning therapies so that they make sense and at the right time. Because you can't do something extreme at the start of your journey just because maybe your body's not ready for that, right? Like you said before, you asked the question, like, when are you ready for LDI? So the whole point is like, you have to prepare the body for certain therapies in order to have the optimal outcome, or prep it in different stages in order to have the proper kind of result that you want.
Those are amazing stories. And I'm going to put links below. I pulled up Dr. Schrader's website. It's just drschrader.com. And this looks like a great article. It says LDA is patterned after enzyme potentiated desensitization developed by the brilliant allergist Leonard McEwen, MD, in England in the mid-60s. So this goes way back.
Yeah, definitely. And yeah, definitely. It's like, I think even he brought it to America in the 90s. So it's even, we've been doing it for, I guess, over 30 years. He's retired now, Dr. Schrader, but he's still involved with it in general because, like I would tell, like, if there's other doctors watching this, I would be like, you should do this. It's pretty, like, I like it. It's so simple, and it can be so effective too when you find the right dose. And it can be so fulfilling when people like have this change that you kind of like, sometimes, like, I don't know, it's not that I don't get shocked anymore, but I'm happy internally, but I don't express it in front of the patient. I'm just like, I'm happy for them, because sometimes like what they say, they're like, no, I'm completely 180. I'm like, interesting. Because it is pretty, like, it's like sometimes like, wow, that's pretty crazy. Because like at another patient, like they had debilitating stomach pains and digestive issues for over like 10 years. And literally within a month when we started LDI, like gone. Wow. Like they haven't felt that better in 10 years. That's the crazy. Like it's like, it's not me. It's the therapy. Like, it's not me. I didn't do it. Like, It's crazy. Of course we did other things with them too as well to kind of get that. But like, I mean, that's pretty crazy when they tell you I've been suffering with this for like 10 or 20 years or whatever it might be. And then like it's like an overnight thing. But again, it doesn't always happen. There's always kind of people that were kind of like stuck and they keep flaring on different LDIs. So it can be difficult. So I don't want to make it like this kind of panacea therapy for everybody and it's going to always work for you and you're going to get that result the next day when you start it, because it's not always true. But there are situations where it can really be kind of like really support and change somebody's symptom picture kind of overnight sometimes.
That's awesome. Yeah. I remember when I went to private university, I had to get a jab and didn't feel good for about a week. And on the website here, it says that it's LDA is used to treat intolerance or sensitivity to chemicals. So I'd imagine that could be adjuvants. So I wish I knew about it back then, because I was slamming chlorella and it kind of helped, but I still felt like crap for a week after I tried it.
No, definitely. Like I said, like LDI in general, you can think of like anything that you can get your hands on that can possibly create a reaction. You can make an LDI too. So like even if it's like different kind of metals that you think there are, or different plastics or whatever it might be, because people are I think as you understand now, like even these days, people are becoming more sensitive to crazier things. There's people who are sensitive to water, right? They can't drink water for some reason, and it could be kind of maybe the plastic that it comes in, or just the sink that it's flowing through, whatever, or sort of the fuss that's flowing through, whatever it might be. But if you have the source of what's creating that problem, you can possibly make an LDI that can be possibly helpful to it as well. Because we can make autologous samples too as well, right? So we can take your saliva, or we can take your feces if we think that antigens are in there that are creating this immunological reaction in your body, and we can make LDIs of them and then give them to you directly and then treat you that way as well. I would say that would be the last thing I would do for a patient, because there's so many LDIs we can try first before we do that. But when we're stuck, that's another way of kind of utilizing LDI and using autologous samples to kind of desensitize yourself, because now you don't know what antigen is bothering you, but you can probably get it in your saliva, or you can get it in your blood, or you can get it in your feces, or you can get it even your sweat maybe too. So it just kind of depends in terms of where we're looking at, in terms of what stage we're at with utilizing LDI as well.
That's amazing. Well, thanks, Nick. This was a lot of fun. Your website's I'm gonna try not to butcher it. Yeah, Irini Healing Solutions.
Yeah, you said it perfectly. IriniHealingSolutions.ca.
Awesome. Oh, what does Irini mean? I think you say it on the site. But
yeah, so it just means, in very simple terms in Greek, peace. So that's why I say bring peace to your healing. Because I know with a lot of people who are, especially complex chronic illness patients, they've gone through a lot, they go through a lot, and I just want to let them know that there is hope out there. There is a possibility of getting better. It's just more about, like, once you find that person or that team around you that's going to support you, you'll find a way to get yourself better. And you can. I think that's a key thing. I think you understand that in terms of what you do too as well. There's so many ways of finding solutions. It's more about, like we said earlier, it's finding the right path and at the right timing of it too as well. But there's always hope. I think that's a key thing too as well.
I love that. That's awesome. And you're based in Toronto, Canada, right?
Correct. Yes.
Awesome. All right. Well, yeah, I'll put your info below, your YouTube channel, so people can check out your stuff. And thanks, Nick. This was a lot of fun. Stick around as we close out the show.
No, thanks, Matt. Appreciate that. It was really a great time chatting with you too, and I learned a lot from you too as well.
That wraps up today's show. That was so fun talking to Nick, another gadget guy. Some of the stories that he says about low-dose immunotherapy and people's success with it is just incredible. And I think in today's times, people are grasping for tools and protocols to help them heal from whatever they're dealing with. And especially now, it seems like chronic infections like Epstein-Barr or Lyme seem to be at epidemic proportions. And I think the key with all of these therapies is to not drive yourself crazy trying to find one that works. My healing journey has been mostly intuitive. where I was drawn to specific therapies that really worked. I got into natural health because I had acne and eczema and skin conditions my whole life. And I was really drawn to sweating in a far infrared sauna. And I started that almost a decade ago in my parents' garage, sitting in one of those zip up saunas on a towel in there naked with the top completely closed. So my whole body, including my head, was in the sauna. And I would just keep my bottle of water, filtered water, outside, and I would sweat for usually an hour, but minimum half an hour. And I did that consistently. And I saw a huge improvement in my skin health. And I was just so drawn to sauna therapy. So I think it's one of those things where you really have to tune in. And if you've been dealing with allergies or infections, then LDI might be something that could really help. I liked what Nick said about the herxing or Herxheimer's reaction. That's where the person is detoxifying, usually using a protocol or supplements, hopefully that aren't doing damage, because a lot of the detox protocols do, in my opinion, like the niacin flush, that form of B3 with the trampoline in the sauna. Definitely not a fan of that. I think that causes more damage than good and puts fuel in the fire of the PUFA problem stored in the tissues. But from what I've been learning about LDI, it seems really safe and effective. And I think it's interesting that Nick said you don't keep pushing with LDI if you're having uncomfortable symptoms coming up. You just actually take a break and back off. And I think it varies therapy to therapy if one should take that approach. If I was in the midst of parasite cleansing and doing an herbal protocol, I know that taking a break would actually allow the pathogens to bounce back, sometimes more powerful than they were before. So with a parasite herbal protocol, and I like the Shen Blossom products like Mountain Detox and their Aka Hinoki, really strong, almost like turpentine resin tinctures. If I were on those consistently, I would not take a break, even if I was feeling crummy. I would just sweat or drink more filtered water. But the whole topic of allergies is fascinating to me. I grew up with pretty severe dust allergies, and if there's pollen blowing in, then I'll sneeze quite a bit. I know in the metabolic community, there's mixed thoughts on antihistamines like diphenhydramine, known as Benadryl, and cyproheptadine. A lot of people think these are not only not harmful, but beneficial. And that's something I'm still looking into. I don't think that all over-the-counter drugs or pharmaceuticals are bad. I'm a fan of integrative medicine. I think there's a time and place for everything in context. I think a big issue is that a lot of people don't have the foundation down, like they're skipping breakfast, they're restricting a macronutrient, whether that's carbohydrates, proteins, or fat. They're restricting one of those, and they're skipping meals, and their blood sugar's dysregulated, and then they're trying supplements and protocols and devices. And I think that's where you don't see results. But where you really see results is if you get the foundation down, you get off the starvation diets, the restrictive diets, and then you add in different therapies and supplements and protocols. That's where you really see results happen. So check out Nick's work. I think he's doing great things. It's at irini.healingsolutions.ca. That's EIRINI healingsolutions.ca. I think he's doing awesome things. I'll put the link below. He also has a YouTube channel. I'll put the link in the show notes to that as well. And the Dr. Schrader article on the history of low-dose allergen therapy, or LDA or LDI, kind of the same thing for the most part. And as always, if you want to support the show, you can go to matt-blackburn.com. I have my blog posts up there, the CLF protocol. I have recipes, my story, my recommended products, all the products that I use, most of which have discount codes. And I actually have a private YouTube school called MitoLife Academy that you can sign up for and see how I use a lot of the products in different protocols. And in this current world of increased censorship, I'm able to speak a little more freely on different tools and protocols that I like for different situations. And my supplement brand is called MitoLife. That's MITOLIFE.co. And I'm doing my best to stay in stock of products. Everything's slow right now because of world events. Just slower to restock things, and transportation is often slower. But most of the products are in stock. A lot of people have really been enjoying the Purely K. The guy that actually helped, one of the guys that helped build the goat fence here, Dissolve It All and Purely K, he said, has really saved him. Way less pain and inflammation with that combination of systemic enzyme therapy and vitamin K2. So I'll put the links below for all that. And thank you so much for tuning in. New show is released every Friday. This is so fun for me. I learned so much from the guests that I interview, and usually I'll have something new to implement in my life. So it's really a blast for me to host this show, and I really appreciate you tuning in and your support. So I'll see you next week. Stay supercharged.